Today we will discuss the critical challenge of combating waste, fraud, and abuse in Medicare and Medicaid. But before we begin, I want to welcome Senator Richard Shelby, the distinguished ranking member of this subcommittee. Senator Shelby is no stranger to labor HHS. He's been on the subcommittee since 2003, but this is his first hearing as ranking member, so it's a special day for him and for this subcommittee. So speaking of things that this subcommittee has been doing for a long time, we turn to the subject of today's hearing, fighting fraud and waste in Medicare and Medicaid. This subcommittee has held 4 hearings over the last 10 years on Medicare and Medicaid fraud and billing discrepancies. Today, as we look for ways to reduce the deficit, the challenge has never been more urgent. When taxpayer funding for Medicare and Medicaid is wasted or stolen by criminals, it means the cost of the program goes up, and so does the pressure to cut back on benefits for the rest. We in Congress have a responsibility to do whatever we can to prevent that from happening. We have compelling new evidence that spending federal dollars to crack down on fraud and waste in these programs is a good deal for the taxpayers. 2 weeks ago, Secretary Sebelius announced that efforts to prevent and root out health care fraud recovered a stunning $4 billion in taxpayer dollars last year, a record high. On average, every dollar that the federal government spent on these efforts returned $6.80 to the U.S. Treasury, also a record high. At a time when this country is struggling with record deficits, this is a success story that we should be proud of. Unfortunately, the House of Representatives seemed determined to undermine these efforts. The continuing resolution they proposed last week would cut $160 million from the omnibus level for combating health care fraud and abuse. Again, I think that's penny wise and pound foolish budgeting. Given the return on the investment of nearly $7 for every $1 spent, that's like throwing away more than $1 billion in savings to the taxpayers. And we hear a lot of varying estimates about how much fraud is out there. I've heard 20% of claims, I've heard 60 billion, and even the HHS actuary says that the return on investment will soon go down, presumably because we're finding the majority of fraud, so it will become harder to find. Point of diminishing returns. You're the experts. How much fraud is out there? Are we close to a saturation point? Are we close to where we're not going to get $7 for every dollar? Maybe are we down to 2 for every 1 or 1.5 to 1? How close are we to that?
Mr. Chairman, as I think you know, we use a 3-year rolling average when we talk about that return on investment number so that we can get a pretty accurate picture of where it is. And the one thing we know is that that return on investment number continues to increase. There is no question that the more we invest in law enforcement efforts aimed at curbing health care fraud, it has an impact in rooting out more fraud and increasing that return on investment. But that said, whatever that saturation point is, we are not there yet. I agree with Dr. Budetti. We're certainly not there yet. And all of the evidence seems to suggest the more we invest here, the better we do.